Hi, I'm Melina Miller, and this is my capstone project on healthcare administration, on the role of the administrator during a global pandemic like what we're having right now with this COVID-19, which is an airborne virus that is transmittable through droplets via nose, mouth, sputum, coughing, sneezing. So the healthcare administrator deals with dynamic decisions that affect many different interdisciplinary teams within the organization. It involves areas of healthcare policy, business, science, and managing fiscal and human resources. Policies are important for the level of quality care that's going to be delivered to the patients. Fiscal management and human resources, which pertain to how money is spent for minimizing costs, and acquires skilled workers for specific duties and motivates them to perform the level of care necessary. Healthcare administration focuses on maintaining the morale and social order of the organization and often serves as an intermediary to all of the various interdisciplinary groups. They serve as arbitrators in situations where sometimes there's conflicting values. And besides supervising and coordinating things with employees, there are internal and external domains. The internal domains are the amount of staff, financial performances, and quality of care that's being provided. The external domain is the community needs, the population characteristics, reimbursements from commercial insurers like Medicare, Medicaid. That was taken from Bushbinder and Thompson, 2010. The healthcare administrator is typically in a nursing home setting, but the role of the healthcare manager depends on the type of organizational setting. Also Bushbinder and Thompson, 2010. If you look at the PowerPoint 4, the nursing home or physician's private practice versus hospital, which are all different. The positions, they're working with different types of department heads, the leaders. The 6 management functions for an effective healthcare administrator, which require to have key competencies, conceptual, technical, and interpersonal skills. The conceptual skills are being able to conduct analysis to determine the best way to complete a task. The technical part is having the performance skills to be able to complete tasks. Interpersonal skills, being able to engage and communicate well with others. And 6 management functions, which were identified by R.L. Katz in 1974, which is from a Harvard Business Review, also Bushbinder and Thompson's 2010. The 6 management functions are planning, organizing, staffing, controlling, directing, and decision making. If you look here, this is the functional organizational structure of a facility and all the different members that a healthcare administrator will have to communicate with effectively to perform tasks within an organization. And that is on, which slide was, that's the slide with the organization. So healthcare has specific divisions of labor with clear lines of reporting and accountability, similar to how the military has a chain of command, the functional organizational structure. Oh, and that's on PowerPoint 5. The leadership styles and why that's important is because employees want to see a manager that's competent, ethical, with good integrity, and demonstrates consistency, loyalty, and openness. That was from D. Janis, Doward, and Schneider from 2019. The transactional leader evaluates performance and rewards on or reprimands based on those things. Charismatic leader leads by emotionally appealing to their follower. They may inspire by focus of the organization more than what is valued to the employee. So what makes a great leader? Right here, this one. They inspire, motivate, encourage, and promote transformations of others. They'll be authentic, humble, excel in communication, inspirational, strong, and intelligent. The transformational leader inspires and builds relationships within the workers in an everlasting change of them, whereas the servant leadership is an unselfish act of putting others' needs before their own. They promote and learn in a learning environment by shared knowledge and power. Risk management, identifying risks, analyzing risks, prioritizing risks, solutions and strategies, continuous improvement, implementing a solution, monitoring the response, and communicating to the interdisciplinary team to ensure there's adherence for achieving the desired goals for results. Documentation mitigates risks and reduces the risk of malpractice and captures value-based purchasing metrics, which governments will often request for determining if services are medically necessary. This includes hospital quality indicators and physician quality reporting system measures. These are high priority by the Department of Health and Human Services and the Centers for Medicaid Service. Implementing a disaster management function. This is PowerPoint 7, page 7. It involves decision-making process, involves information, systems modeling, graphical notations to prepare for infection prevention, diagnostics, patient care, staff and communication. Prevention and mitigation is the ways to avoid the impact and deflect. Evacuation is getting patients and the organization out of harm's way. Humanitarian logistics is obtaining relief supplies and medical supplies after the facility has victims to care for that need to be medically treated. Casualty management is move the affected casualties to a safer place like a hospital if needed and specialized medical treatment facilities, or employees may ask to be to stay home or to self-quarantine because the elderly are frail and are more at risk. Restoration and recovery, damage assessment. The facility will need to get back up and running again. So there'll be a lot of cleaning up, restocking supplies, equipment repair, restaffing. Patients will return from hospitals or from safe areas or possibly from home. So family members may want to bring them back into the facility. That was from Gupta, Starr, Fahrenheit, and Matinrad from 2016. So a checklist for a long-term care facility and skilled nursing facility, things that the healthcare administrator will want to do is to identify the ill patients and treat them. They're going to look for strategies for limiting visitors and limit the amount of entry points within the facility. They're going to cancel all the group activities and stop any non-urgent outpatient appointments that they may have. They're going to look at obtaining supplies and resources. And they're going to need to look at the sick leave policies because some employees might need to take some time off or work possibly even longer hours during the time of need. The education and standards, they want to make sure that everyone is highly trained in the transmission-based precautions knowing how to don PPE, wash their hands, reduce risks of contaminations. Staffing needs are going to need to be adequate, the equipment and the supplies, and possibly post-mortem care. Establish reporting between facilities and to the public health authorities. So, and here is a little chart I put together. I got this from the CDC website. It is how to properly don and doff all the different personal protective equipment. There's a certain way to take them off. So these organizations and government protocols, they're both federal and local government agencies. They're available for the healthcare administrators to access any information that's necessary during daily care or during an emergent type of hazard care. Training is available. You have the Occupational Safety and Health Administration. They have a website, osha.gov. The CDC, the Centers for Disease Control and Prevention, has the cdc.gov. You've got the Food and Drug Administration, NOSHA, which is the National Institute of Occupational Safety and Health, which is part of the CDC, and it's dedicated for the workers' safety and health. Then you have DHEC, which is, it's more of a state government. It's the Department of Health and Environmental Control. They have protocols also available for PPE, and if you look at the PowerPoint page 9, that's this one, it has the information on there. So, and also what we found out too is that guidelines can change quickly or be updated. So it's necessary to stay current on all these guidelines. So accessing the CDC website and knowing when these changes occur, as what we found out with this COVID-19, initially it was said to be a droplet precaution, and no one was to be wearing masks unless they were working with an active COVID patient. But that quickly changed, and now we're all wearing scrub masks, and if we're working with a positive patient, we're putting on our N95 masks and being more cautious and wearing more protective gear to ensure that all our employees are not getting sick. Well, that's how it is at my work right now. So we just started wearing masks for the past 2 days. And I think depending on what state you're working in, some of the changes they're at a different part of the apex, so they're all starting at different times. So here are the strategies for, I think that's the one, yeah, for the hand washing and the stay at home and cover your cough and sneeze, avoid close contact, clean and disinfect, and avoid touching your eyes and your nose and your mouth in the hand washing techniques. And that is available on PowerPoint 8. So, and what they're saying now is the social distancing, which is 6 feet. So that's the distance to where they're saying that you're less likely to breathe in that aerosolized cough or sneeze, the sputum. So as I mentioned, OSHA, they have a labeled link on their website. It's called Outreach Trainers, and healthcare administrators can access it and get information on either 10 or 30 hours of outreach training classes. So there definitely is some information on these organizations on their websites for administrators to access to get further prepared for their role. So, and many organizations have limited access to facilities, to care related only or end of life. They've, like I said, they've closed the entrance off. There's only one entrance to get into my facility. And a lot of family members are saying hello to their loved ones through windows on cell phones. And they're allowing communication through our activities girls are using FaceTime techniques for a lot of the patients and residents to be able to communicate with their family members on scheduled times via FaceTime. So let's recap. Understanding the role of the healthcare administrator leads others to disclosed action plan, effectively communicating to achieve the overall success of the organization. The leadership style and trust from employees in the organization can greatly impact on how the team works together, especially during high stress situations like a disaster. The healthcare administrator works with both internal and external domains in the healthcare to ensure there is adequate staffing, financial performance and quality care, and deals with community needs, population characteristics, and reimbursements. Here's my references. And also the 6 management functions: planning, organizing, staffing, controlling, directing, decision making, and then the key competencies to effectively carry out those 6 management functions, which were conceptual, technical, and interpersonal skills. So a leader who has a clear plan in place can reduce stress, anxiety, and apprehension when dealing with threats like global pandemics such as COVID-19. Thank you.